Welcome everyone to the Prosper series. My name is Adriana and I support Celo community. So to get started, I would love to hear where folks are calling in from or dialing in from. I'm here in El Cerrito, California, and the purpose here is to create a space where we can envision, ideate, and create a new world of prosperity for all. So this is a great time to bring community together. So let's hear where everyone is from in our virtual room. So welcome, Laurence from San Francisco. Bart from Switzerland, wonderful. I always love the international flavor that we get on these calls on Fridays. And so go ahead and as you join, you're welcome to go ahead and share where you're calling in from. And so today, I am super excited about the topic of financial inclusion for international health. And we have a Celo member here that will be sharing on this topic, the intersection between cryptocurrency, Celo, and supporting international health NGOs. And so to get started, I want to just first give an overview of Prosper. If this is your first time watching this series, Prosper began as an in-person retreat to bring developers, designers, dreamers, and doers together to envision a new world of prosperity for all and beautiful money. And so this is us back in November of this past year when we gathered in the woods of Mendocino, California to explore this topic. And so, of course, with the current state of the world and COVID, we were planning on doing another in-person retreat this summer, and instead we're bringing this content online into a weekly series right now until the end of June to gather around this virtually. And so before we get started, I like to begin with a short meditation to get us grounded and receive the content. So if you feel comfortable, I invite you to gently close your eyes and to allow yourself to relax into your seat. Taking a few deep breaths here and feeling where your body is touching the seat below you. Breathing into that place of contact. And from here, breathing all the way down into the core of the earth. And then breathing up the spine, out the crown of the head. And from here, I invite you to connect to your heart space. And in the words of Charles Eisenstein, how beautiful can life be? We hardly dare imagine it. And so I invite you to imagine how beautiful life can be in this moment. Just noticing the images, the sensations, the feelings that arise with the most beautiful world that you can imagine. And perhaps noticing your part in creating that world. What's one thing that you can do to contribute towards this vision? And then after your next breath, gently opening up your eyes and coming back into the room. And so with this series, we like to take steps towards that new beautiful world. And so I am super excited to have Marc Bonenberger here with us. And we will be talking about how Celo can facilitate the work of international health NGOs and help their beneficiaries in developing countries. And so Marc is a special health specialist, public health specialist, and also an epidemiologist who's managed public health and research projects in Africa and Asia. So he currently is a program officer at FAIRMED, where he manages a number of public development projects in Nepal and Sri Lanka that has targeted neglected tropical diseases, also called diseases of poverty. And so he's also a crypto enthusiast and has joined a validator group on Celo. And so before welcoming him up to the stage here to present on this topic, I want to first share a short introduction of FAIRMED so that we can understand what those tropical diseases are as a background. Just giving me one moment here to bring up the video.
Plus d'1 milliard de personnes dans le monde souffrent d'une maladie tropicale négligée. Les plus démunis sont particulièrement touchés. Souvent, ils pourraient être guéris par les moyens les plus simples. Mais malheureusement, il leur manque un accès aux soins médicaux de base. Nous pensons que personne ne devrait souffrir ou mourir d'une maladie curable. Pour cela, nous allons au bout du monde. FAIRMED, santé pour les plus démunis.
And so with that, I would love to welcome Marc up to the stage to... Oh, hold on one second.
White, individual hair.
Oh, there we go. Got some noise there. All right, so welcome, Marc, to the stage. I'm so excited about this topic, and thank you for joining us this morning.
Thank you very much, Adriana, for inviting me here.
Awesome. And so if you want to share your screen, I can put it in the center stage.
Oh, where I'm sharing again?
Yes, so you can use at the top of your video, there's a share screen
Yeah,
button.
I have it here.
And also welcome Matthias from Luxembourg.
I have to quickly restart my Chrome. I'm sorry for that.
No worries.
To share my screen, I need to restart Chrome. 1 second, please.
Sure. This is the beauty of doing events online. And welcome, Victor from Austria. So in the meantime, if you want to check out FAIRMED, you can check out their website here.
Okay, I'm back again.
Awesome. So I will.
I think it should work. Can you see my screen?
Yes, perfect. And we have it in the center.
Pardon?
We see the screen and it's now in the center, so we're good to go.
Okay, very good. Yeah. So welcome everyone. I'm delighted to be invited here at the Celo Prosper series to give a presentation on financial inclusion for international health. Thank you also for introducing me. As as Rihanna said, I'm working at FAIRMED as a program officer, having a background in public health and epidemiology. And I'm responsible for managing the projects we have at FAIRMED and Nepal and Sri Lanka. So let me please introduce a little bit FAIRMED, that you also understand what we are doing, where we are coming from. So we have been founded in 1959, so quite a while ago. In the past as Leprosy Emmaus, Switzerland. We had our first project in 1960. We started in Cameroon. So since then, since 60 years, we are now being active every day to work for the poor in developing countries, especially, and we are known in the German-speaking world as the organization which goes to the ends of the earth for sick people. Of course, this picture is a little bit of an I love it actually. It's not exactly where we go, but you may get an idea that where we are usually are places which are not very touristic, and where the people who are most neglected in the world are living, being affected by poor access to health services, being affected by diseases, the so-called diseases of poverty, neglected tropical diseases, which are usually very easy to cure, very cheap to cure, but people who are living in such environments are usually very often don't have access to such services, living with diseases, dying from diseases, from which they actually shouldn't die because they are curable. Which brings us to our vision. Our vision is that nobody should suffer or die from a curable disease. And we want that all people live in a just and healthy environment with fair access to holistic health services. Our project areas are in Southern Asia, Nepal, Sri Lanka, and India, and also in Africa. So we're usually providing a range of services together with the government. So we are never providing a parallel system. We're always working together in close collaboration with the governments, trying to strengthen health systems together with the governments, training healthcare staff, contributing an active case search, similar to what's going on everywhere in the world in the current COVID-19 crisis. So we are participating in active case search for diseases we are working on. We are creating awareness in the community on how to prevent such diseases, also sensitizing them on the use of using institutionalized deliveries. Births don't deliver at home, but use the health services. You also train the health staff to provide such services. And so on. So the same is actually ongoing also in Cameroon and Central African Republic, where we are. There's a little bit of a difference because Central African Republic, for instance, is more or less a failed state. It's a country which is struck by civil war since at least 2010. Also, previous history was also quite difficult. So we are also providing humanitarian services, especially in the south, here in this area, which is called the Lubaye, Central African Republic, where we actually essentially running the health system, employing medical staff, medical officers, equipping health centers which have been destroyed by the civil war. So that without us, there wouldn't be any health services in this area. Cameroon, much more stable, but also in the north is where Boko Haram is active, so a terrorist group. So they're also having some difficulties. Our mode of operation, this is a health system. It's usually here at the primary healthcare level. So there where people access health services, and then they might get referred to higher levels like regional hospitals for specialized services. Our guiding principles are that patients are in the center of our interventions. But we also, as I said, we're working with partners, we are strengthening local competence, we are providing financial stewardship, we're having a rights-based approach. We are not only working in the health sector, but we're also working with other sectors like agriculture, education, and so on. And we're always having a balanced approach, including all gender, men and women, children, and so that we are not leaving out any groups in our intervention. So the concept of poverty, and which also brought me to get interested in Celo, is this vicious cycle of poverty and disease, which goes like people who are poor, they are also having lower intake of food, so they're having less food, leaving them undernourished, being undernourished, making them more prone to get infections. Having infections, especially in childhood, leads to stunted development and faltering growth, which in turn does not allow them to fulfill or develop to their full potential, having small body sizes, being not that good in school, which then in adult life leads to impaired productivity, and then in turn also low earning capacity, and which gets them stuck in the poverty trap, what we call it. So there should be ways how people can escape this poverty trap, which usually without outside interventions, it's not really possible. So people who are poor usually stay poor because they are trapped in the vicious cycle of poverty and disease. This is why actually me personally became interested in Celo. Not so much in my capacity as a program officer for FAIRMED. So we as FAIRMED do not have projects which includes cryptocurrencies. But me personally running the LetzBake staking service, as was also introduced by Adriana. But I can see many areas where international health NGOs or NGOs in general could benefit from a stable virtual cryptocurrency. I didn't see these benefits on other cryptocurrencies like Bitcoin, Ethereum, and so on, even though, of course, I like Bitcoin. I'm a Bitcoin bull. I'm an Ethereum bull as well, personally. But I don't see, at the current state of cryptocurrency, I don't see a use case in international health, mainly because of this highly volatile state where cryptocurrencies are into, and also for the foreseeable future. So people affected by poverty who suddenly get access to a non-volatile cryptocurrency, Celo, US dollar, there are certainly benefits on which I actually talk a little bit more of during this presentation. Of course, remittances, meaning money being sent home by people abroad to their home country. It opens up opportunities for microfinancing, conditional payments. What this is, I will also refer later in this presentation. Also direct cash transfers, which is a thing since past at least 10 years in international aid, especially in humanitarian crisis. But also for international NGOs and health NGOs, it opens up opportunities, especially as we are usually transferring huge amounts of money to our project countries. Also, of course, for procurement and transparency in the international aid sector. So let me go over most of these points, not all, because time does not allow for it. First, the volatility. Of course, I take Bitcoin and Argentine peso as an example because it's quite popular in the cryptocurrency scene. We all know it's quite volatile. Many people are actually speculating on this volatility. They want this volatility. If you invested in 2016 an amount of money and hold on it, then by 2017, December, you would have gained, if you are in Argentina, 7,500% of value increase of your Bitcoin. This is, of course, very much impressive. But of course, then this was followed by 80% decline by 2019. So people who are poor, for them, it's quite a devastating situation. People who are usually in the crypto scene, of course, it's also not a very good experience. But I assume that most of us who are in crypto expect these things to happen, and we can also do with it because we may belong to the lucky 1% of the world's population which earns more than $50 a day. But the huge percentage of people earns less or lives on less than $1 or $2 a day, who don't have the means to save money, to hodl on their money from 2018 to 2019. So they actually need some sort of stability. Of course, this is a long time frame. You can also have a shorter time frame. Just recently, 2020, May, most of us remember the 50% decline just in a day of Bitcoin. Of course, if poor people who experience such volatility and they need to access, for instance, health services, and now they can only access 50% of health services, this is not tolerable. Because you can also see that health expenditure can be costly, and it's more costly the less you earn, because you don't have that much income to invest or to pay for health services. This is called out-of-pocket expenditure. Even though health services are free in most of the countries we work in, there are still costs attached to it, because you have to buy the medicine, which is not free. You have to come to the health service by public transport, which is also not free. So in the end, even though the health service is free, like here in Sri Lanka, for instance, or in Nepal, health services are free, but still there are costs attached, which can sum up to 80, 90, even 100% of your visits at the doctor. So having a stable currency is essential for people who are affected by poverty. So as I said before, remittances is a very big market. Like, for instance, India is sending home $83 billion, which sums up to 2.9% of the GDP. Of course, it's a middle income country. But Nepal is one of the least developed countries, unfortunately, in the world. $8 billion is sent home by Nepali people every year, which sums up to almost 1/3 of the GDP of Nepal. Then you also have an African, Cameroon, very active, and Central African Republic, where it's rather neglectable. For Central African Republic, we don't even have data. Data is not available, but we have to remember that this is a country struck by civil war. So the information coming out of this country is not always reliable. But in total, remittances payments sum up to $638 billion. And of course, every dollar which is sent home also goes to one of the money transmitters, being it or a middleman, being it a bank or being at Western Union, who takes up quite a big share of this money from people, which is sent home to people who might need it the most. And studies have also shown, of course, that remittances have a very positive effect on household welfare and can increase standard of living of the most left behind families. But of course, it also creates dependencies, because if you imagine that the person abroad suddenly loses his job, which currently happened during COVID-19, for Nepal, thousands of people have been sent home from India to their country because there was no job because of the lockdown. So this, so we can expect that for 2020 it won't be $8 billion, but certainly a little bit less. Then, of course, digital or virtual currency could also have a very good use case in microfinancing. Banking the 1.70 billion people who don't have access to banking services. What you can see here is a picture from one of our projects in Nepal, where we are working together with the local cooperatives to loan out money to people with disabilities. Before we have been there, no money was loaned out to people with disabilities, because we have been told that people who are disabled cannot work. So we are not giving them any money or microfinancing. We could convince them by actually paying into the cooperative that they're giving out this money we paid in to people with disabilities, which turned out to be a huge success. What we can see here is a blind man living in the northern parts of Nepal. He was not born blind, but he had some genetic failure, which caused him in his youth to become blind. And we trained him to make these sort of stools, colorful stools, which are now in very great demand in this area, not only from him, but there are more than him who are producing these stools to make an income. And so he loaned some money to get materials for these stools. And now, even though he's not rich, but he still is able to earn some income for his living. So where I also see a use case is for cash transfer programming, also called CTP, which in the past 10 or even 20 years became quite popular in international aid programming. It can take the form of either giving cash directly to people, either direct cash or e-cash. It could also be a voucher for which people can redeem to get certain services like buying food, access a health service. What we are doing in the Central African Republic, we're giving out vouchers to the local hunter-gatherer community, women who are pregnant, who are usually not delivering in a health facility. We are giving them a voucher which they can use to receive antenatal services, so pre-birth services, which they would usually not be able to afford to pay or not even be interested to use. Then it can be unconditional, conditional, these CTPs, restricted, unrestricted, which means that you can, it's actually, if you restrict the use case, people who receive this cash transfer cannot use it for everything. They can only use it for specific services, like for the health services in the voucher system we have in Central African Republic. What I was thinking here is with Celo dollar, it could also be this CTP could be strengthened, for instance, through smart contracts, allowing recipients to spend their Celo dollar not everywhere, but only in a grocery store to buy food, yes, to access health services and so on. So I see an advantage also with programmable money, programmable virtual money, opening potential solutions which are not currently possible. So that cash transfer programming is the thing. You can see here that the World Food Program in 2015-16 spent $1.2 billion directly in cash transfer programming, or 24% of the operations went into cash transfer programming. Also, the UNHCR, which is the refugee arm of the United Nations, also spent $430 million into CTP. The Red Cross, $61 million, and so on and so on. So I see that there's a huge advantage of a digital dollar for these operations, which could be quite interesting in aid programming. So then also for international health, I can see also quite advantages. If you see here only for official development assistance, or ODA, which is money provided by governments to recipient countries, either through bilateral assistance or through NGOs who apply to get money from governments for their to provide services or strengthen health systems or whatever. You can see that alone for ODA in health, it amounted up to $24 billion in 2017, and 2014 was as low as 20 billion, but it's quite an impressive sum. All of this money was sent to legacy traditional banking system with all slowness, cumbersome transactions, costs, and so on. So if this would be possible to send just in an instant, low cost to the recipient countries, these would be great advantages. And of course, there's no volatility, so there's no risk that you send this money and then once it arrives, they're just worth 50% of what you sent. But what you don't see here in the statistics is the money spent in international health programs from the international NGO scene, because this money is this information is not easily accessible. All of us are required to publish this information, but it's not aggregated anywhere. So therefore many people complain about the intransparency of the international health or international aid sector. This information is available, but you have to go to their home pages to look in the audits, annual audits, which you can find at country level, which you can find at headquarter level. We have this information, but it's not really aggregatable for the entire sector. So for instance, for Nepal, you can see here, this is from IATI data. IATI is the International AIDS Transparency Initiative, which was founded, I think, 2009, 2008, maybe 2010, not quite sure about it, which was actually developed as one of the means to increase transparency in the international sector. But it's voluntary to take part, to participate in IATI. Usually NGOs participate when they are required to do so by their government donors. So you can see that all the government donors, the biggest USAID, USA, the Kingdom, and so on, they're all there. They're heavily using IATI. But the international NGOs, they are not so much there. You can see Bill and Melinda Gates Foundation, who had a project, or have a small project here with $285K spent in 2019. But most of the international NGOs you don't find in this database. So if everyone in the future would transact over a blockchain-based systems like Celo, it would certainly considerably increase transparency also in the sector. So if all of this billions of dollars sent every year to AIDS recipient countries, and if all this information is stored immutable on the blockchain, This would provide transparency which has not been seen before. But of course, there are challenges. I only singled out 3 challenges, but there certainly are more. The first one is accessibility to mobile phones, of course also smartphones, which are required for Celo to receive Celo dollars. To use Celo dollars, you need a smartphone, but of course you also need electricity. If you can see here a map of Africa, where you can also see a huge number of countries which are marked as red, which means that 75% of the population currently don't have access to electricity. And then you also see mobile phone penetration, unsurprisingly, is also quite low in those countries, because first, people are poor. Secondly, people don't have access to electricity. But it's usually those people who are the left behind populations when we talk about left behind people. These are the left behind people. You can also see here pictures from our project countries in Central African Republic and in Cameroon, which are called the Baka and the Aka, which are hunter-gatherer societies, pygmies, people from the forest, and yeah, those are the faces of people which we talk about when we mean those who are the furthest left behind populations in the world. They don't have a mobile phone. They might not even have access to electricity or not even have a use for electricity. Very often their exchange is in barter and not over mobile phones, over cash. So exchanging skin from the forest, from animals they hunt in the forest against honey or other things which they get from the neighboring Bantu populations, which are also living in the same area. Both are actually quite similar groups. They are quite related, but they are divided by the border between Cameroon and Central African Republic. Yeah, it might be a very extreme example, but when we are talking about banking, the unbanked, providing financial inclusion to everyone, prosperity to everyone, these are also the people who are included in this group of left behind, of poor people. Then another challenge is that currently there are no or limited Celo on and off ramps. So people need a means to get Celo dollars, to change the Celo dollars back to their local currency. What is a popular example of a digital currency also put forward by Celo is M-Pesa, but there is actually another one which is much bigger than M-Pesa, which is MTN, which is used virtually all over Africa, but also in Iran, Afghanistan. It's a South African company with a slogan, "The future of money is here," with their Momo service. It's quite similar to what Celo once tries to achieve. Of course, it's not a blockchain service, but it's quite popular all over Africa, used all over Africa. What's more, you don't even need a bank account. They're also having this slogan. And people are quite used to this service. So it's quite convenient to get access, because they also need to buy vouchers to charge their credits for the mobile phone to make phone calls, and then they can also charge a little bit more to make micropayments. So it's quite popular, and you can also see here below that there are 13,868 agents or on-ramps, off-ramps in Cameroon alone, where people can get access to the Momo service. So this is what, in Africa at least, what Celo would somehow compete with. And also MTN has quite of a head start, yeah, to competitor, if you want so. Then, of course, there are regulatory permissions or concerns. In each country where Celo is introduced, one needs to work closely with the government, also checking securities, investment laws. Maybe it's not so relevant for Celo US dollar, but for the Celo Gold or Celo, which is quite volatile, which is a cryptocurrency, there might be permissions needed from the government. Then you also have laws regarding banking and money transmission. For instance, in most of Southern Asia, it's not allowed that people transact in a US dollar. People need to transact in the local currency, the rupee, be it Nepali rupee, be it Sri Lankan rupee, or Indian rupee. They cannot receive, or they can receive money in US dollar, but in order to use it, they need to change it first into their local currency. So I believe for Celo to get foothold in at least Southern Asia, it would be required that Celo introduces digital rupee as an initiative to being able actually to be used by the people living in Southern Asia. Then, of course, you also have anti-money laundering laws, you have CTF laws, counter-terrorism financing laws, which is especially relevant in countries who are suffering from terrorism. For FAIRMED countries, it's especially Cameroon, where you have Boko Haram, but also Sri Lanka. You might remember that last year, 2019, there was a terrorism attack in Colombo and the surrounding areas, where it is also believed it was not from the local groups, but that they had help from the outside, from the Islamic State, IS, because the local groups, they were aware of that they are in the country, were not really a threat, they were not really organized, so it was not really believable that they have been able to carry out such an attack. At the same time, bombing hotels and churches, 6 at the same time. But actually, since this terrorism attack for us as FAIRMED, sending money to Sri Lanka, sometimes can be quite cumbersome. Now, international NGOs are controlled by the Ministry of Defense, meaning that it allows them to further scrutiny every transaction received by international NGOs. So for us, resulting sometimes in money getting stuck at the bank because it needs to be, first questions need to be clarified. What this money is intended for, where this money is coming from. What is the purpose of FAIRMED? Are we actually having sentiments towards the government? Will this money be used for financing counter-government sentiments and so on and so on? So it can be quite cumbersome. And for digital currency to be used, it must be possible that such a currency is integrated into the government system, that they are easily being able to see on the blockchain the money flows into the country and out of the country. So these are just some of the challenges. As a final slide, I want to show you this picture of the man in Cameroon. He was in his youth or childhood, he was affected by leprosy. He lost his fingers, he lost his foods, he is blind because of leprosy. Of course, he is cured since decades. He is not infectious anymore, he's not suffering directly from leprosy anymore, but he's suffering from the consequences. But still, he's not a sad man. He is smiling. He's a happy man. And actually, but if you're talking about people who are left behind, this is one of the faces. So we are working hard to also provide services for these people. Thank you very much for your attention.
Wonderful. Thank you so much, Marc. So folks can go to fairmed.ch, and that is in the chat window. Thank you so much for your work, Marc, in putting this together and bringing the different pieces of poverty, international health, and crypto so beautifully presented so that we can see where the possibilities are, but also where the real challenges are. And, you know, yeah, and, you know, to your point, prosperity for all, how do we reach these people that are the most poor without even electricity? And there's certainly challenges ahead, but that's why we gather weekly and we have a community. Please, those of you that are on the call here today, we invite you to join our Discord channel. There's a button down below so that we together can come up with solutions of these barriers for prosperity. So I would love to see if there's any questions. We do have an Ask a Question button below or in the chat. So just want to wait a minute if you do have questions. And also following this, we'll have a community Zoom chat where we can meet each other and you can talk to Marc directly face to face.
Thank you.
Okay, great. So maybe we'll get some questions in the Zoom. So I will post the Zoom link in the chat. And I just want to thank everyone for joining us today. And also, we can't have prosperity for all without racial and social justice. And so next week, we will have Robbie Greenfield from Emerging Impact here talking about Crypto for Change and the pledge that he started to support that. So I look forward to connecting with you all there. And I will just take the link for the Zoom real quick and put it in the chat. And I look forward to connecting with you all there.
See you soon.